Alteration in musculoskeletal function, part 2. And it'll take me just a minute to get back to where we were. We're going to start talking about osteomalacia. Osteomalacia is an inadequate or delayed mineralization of the bone. It occurs in mature, compact, and spongy bone. You have calcification and deposits, deposition that does not occur. This is very similar to rickets in children. So you've got bone that's very soft. Some causes could be a metabolic disease, like malabsorption, disease of the small bowel, pancreas, or the hepatobiliary system, a decrease in vitamin D, renal tubular disease, or anticonvulsants, because anticonvulsants decrease calcium absorption from the small bowel and vitamin D metabolism in the liver. Now, osteomalacia oftentimes settles in the hip, altering their gait, so they'll have a waddling gait. Symptoms are low back pain, skeletal pain, tenderness, weakness, that waddling gait, bone fractures, and vertebral collapse. Major risk factors are a decrease in vitamin D, that decreases your calcium absorption, an increase in PTH, which increases phosphate excretion and increases calcium into the vascular system. So that decreases the mineralization of the bone a little further. And here's a picture of osteomalacia in a child. You can see by the x-ray that there's bowing of the bones because they are soft. Paget's disease is a state of increased metabolic activity in the bone. You'll have excessive bone resorption and formation results. It's due to a viral infection, tumor, or vitamin D deficiency. It most often affects the vertebrae, skull, sacrum, sternum, femur, and pelvis. I really don't know the cause, but the symptoms are either none, or you have a skull that thickens and becomes asymmetrical. You get a headache that impinges because it's impinging on the optic nerve. You may get deafness, displaced teeth, and it impinges on the spinal cord. It can cause stress fractures. And this is a diagram showing Paget's disease. This develops a disordered architecture and is found more commonly in the elderly and in males. The mechanism for this pathology is unknown. Under the microscope, the disease shows disorder of the basic structural unit, normally an arrangement of concentric Haversian systems. Radiographically, this is reflected in the loss of normal distinction between cortex and medulla of the bone. The trabecular detail is lost or blurred. The disease process frequently starts as an area of low bone density adjacent to a joint or a bump on the bone that might be part of the joint in a different animal. The affected bone is softer and more prone to material failure. This may produce a stress fracture. The bone is often enlarged. Its greater weakness means that it is often bent or deformed. The requirement to support a mechanical load is unchanged. The pattern of bone density may still coarsely reflect the mechanical load, especially if most of a bone is involved by Paget's disease. In the pelvis, the denser bone often lies between the acetabulum and the sacroiliac joint, for example. Because there is greater vascularity, the limb is warm. If very extensive, involvement of a bone can be a contribution to congestive cardiac failure. Paget's disease is associated with an increased risk of sarcoma changes. The underlying Paget's disease is not always obvious, however. Infectious bone disease, osteomyelitis, is due to bacteria, fungus, virus, or something of that nature. It can be a cutaneous infection, which is a skin infection, cutaneous meaning skin. It could be due to a sinus, ear, or dental infection, or an infection of the GI or GU tract. Obviously, osteomyelitis is due to an infection. There are different types. You have exogenous osteomyelitis that's due to a fracture or surgery. You have endogenous or hematogenous osteomyelitis that's due to problems elsewhere in the body, usually due to Staph aureus. This tends to occur more in infants, children, and the elderly. The symptoms are abrupt onset of inflammation, and yet they're kind of vague symptoms. It's very difficult to treat. Because the bone has multiple microscopic channels that do not allow the body's natural defense mechanisms access. You have microcirculation of the bone that is highly vulnerable to damage and destruction by bacterial toxins. And we have a limited ability to replace bone that's been destroyed by infection. Symptoms, as I said, are vague. We've got fever, malaise, anorexia, weight loss, lymphadenopathy, pain, and swelling. And here are our Haversian canals, which shows how difficult it is to get to the blood supply to the bone because of these Haversian canals. And osteomyelitis is an infection in the bones. Often the original site of the infection is elsewhere in the body, and it spreads to the bone by the blood. Bacteria or fungus may sometimes be responsible for osteomyelitis. And here we get another osteomyelitis showing your initial infection on the far left. This is an area of devitalized bone. Then you've got your first stage where you have involucrum, which is new bone surrounding the infection. It contains openings to allow for exudate to escape into the surrounding soft tissue. The infection can be acute, subacute, or chronic in nature. X-ray changes take 2 to 3 weeks to develop. Symptoms in children are fever, elevated white count, elevated C-reactive protein because it is an inflammatory process, and an elevated SED rate, pain, swelling, and warmth at the site. Septic arthritis can occur in children as a result of bacterial or granulomatous infection of the joint space. It is a surgical emergency. It can be primary or it can be secondary to osteomyelitis. It tends to occur mainly in the knees, hips, ankles, and elbows. Symptoms are severe joint pain, pseudoparalysis. They're not really paralyzed, but they feel like they are. Inability to bear weight, malaise, anorexia, and an elevated C-reactive protein, again an inflammatory marker. This is usually due to Staphylococcus aureus. Disorders of joints. You can have non-inflammatory joint disease. There are 2 different types, degenerative joint disease and osteoarthritis. With this non-inflammatory joint disease, you're going to have loss of your articular cartilage in your synovial joints. It causes sclerosis of the bone, which is now dense and hard, and they'll develop cysts. These affect men and women over 40, but the women become sicker. It's a common age-related disorder of the synovial joints, particularly your hands, your hips, and your spine. And here's a picture of osteoarthritis. You have a healthy knee joint on the left, and you have osteoarthritis on the right. It's a chronic disease of the joint, cartilage, and bone, often thought to result from wear and tear on a joint, although there are other causes such as congenital defects, trauma, and metabolic disorders. Joints appear larger, are stiff and painful, and usually feel worse the more they are used throughout the day. Risk factors for osteoarthritis, there's a box on page 1047. Trauma like a sprain, strain, fracture, or dislocation. Long-term mechanical stress, like if you're a ballet dancer or an athlete or do a lot of repetitive tasks with your hands. Inflammation of the joints, which digest the cartilage cells. Joint instability due to damage to the support structure, your tendons and your ligaments. Nerve problems as a result of diabetic neuropathy or an increased tendency for abnormal positioning or weight bearing. Congenital or acquired skeletal deformity, it can be. Hemophilia, or hematologic problems such as hemophilia, because it will bleed into the joint. Endocrine problems such as hyperparathyroidism will increase calcium being pulled from the bone. And medications such as colchicine, steroids, and indomethacin increase the rate of cartilage loss. Now, colchicine and indomethacin are used to treat gouty arthritis, and steroids decrease the inflammatory response, so that can be part of the problems. Symptoms are pain in your joints with greater with weight bearing or use, stiffness, a decrease in range of motion, enlargement of the joints that show a deformity, swelling due to the effusion that can occur from the inflammatory response, muscle wasting, dislocation, paresthesia, again, numbness, tingling, or prickling, crepitus, which is a crackling sound, creaking, or a grating sound can occur. Now, inflammatory joint disease, one type is rheumatoid arthritis. Rheumatoid arthritis. Now, it's unclear as to what initiates and perpetuates this process, but they do know that it's an autoimmune disease that causes chronic inflammation of the connective tissue, particularly the joints, and that we develop antibodies or rheumatoid factors for IgM, IgG, and IgA. They do think there may be a genetic component, or infection could be part of the cause. It is an inflammatory response that causes hemorrhage into the joint with coagulation and fibrin deposits. It increases in prostaglandin release, causes increased permeability of the vascular system. So fluids and toxins go into the joint, causing edema. And edema and toxins compromise the circulation to the joint, causing ischemia and hypoxia. Symptoms are fever. Fever because it is an inflammatory response. Malaise due to the decrease in nutrition available because the basal metabolic rate will increase with the fever. A rash is probably an autoimmune type symptom. Anorexia is due to the release of the toxins. Weight loss because of the anorexia. Stiffness because the joint doesn't move as well. Lymph or spleen enlargement because the lymph is how the wastes are removed, and the spleen produces cells that are used in the inflammatory process. The inflamed, painful joints are due to pressure from the exudate. Rheumatoid arthritis affects about 2% of the population, mainly female, smokers. Does have a family history, and it is worse in the winter as things stiffen. And here's what rheumatoid arthritis looks like. This is a late stage. You'll get the boutonniere deformity of the thumb, the ulnar deviation of the metacarpals, and the swan neck deformity of the fingers. Now this is a flowchart for possible causes of rheumatoid arthritis. You can have environmental stimuli, such as an infectious microorganism, a genetic predisposition, activation of the complement system, continued immune response, and it gets there's a possibility for the theory of its cause. Complications of rheumatoid arthritis are due to excessive amounts of the inflammatory exudate in the synovial cavity, causing formation of cysts and fistula. Rupture of a cyst or a joint can spread the inflammation. Rheumatoid nodules or swellings occur over the extensor surface of the elbows and the fingers. It can invade the skin, the heart valves, the pericardium, the pleura, the lung, and the spleen. Now, Kaplan's syndrome is when you have pulmonary nodules and pneumoconiosis. Pneumoconiosis is a chronic inflammation of the lungs from dust. You'll find that coal miners get it a lot. It can also cause diffuse pulmonary fibrosis and Raynaud phenomenon. And here is, from the memory book, rheumatoid arthritis. What to assess, the risk factors, clinical manifestations, and treatment. A lot of information on how it's diagnosed. They're looking mainly for the diagnosis, looking at inflammatory markers, and for your rheumatoid factor. Juvenile rheumatoid arthritis has three different modes of onset. We have oligoarthritis, when less than 3 joints are involved, or polyarthritis, where more than 3 joints are involved, or Still's disease, which is a severe systemic onset. It differs from the adult form in that the large joints are affected more. You'll have chronic uveitis, which is inflammation of the anterior chamber of the eye, and can cause permanent vision loss. And that is common if the ANA is positive. Rheumatoid ANA, by the way, is anti-nuclear antibody. Rheumatoid factor may be negative. It can cause subluxation and ankylosis of the cervical spine. It can have severe effects on growth and adult morbidity. And if you have a positive anti-nuclear antibody, the effects of rheumatoid arthritis are probably going to be lifelong. Ankylosing spondylitis is a chronic inflammatory joint disease. It's inflammation of the fibrocartilage, increased collagen formation that causes an increase in scar formation, so the joints will fuse or decrease their flexibility. Ankylosis means fusion. Tends to affect the vertebrae, the sacroiliac joints more often. It does have a genetic predisposition, and it does have systemic side effects. Symptoms are pleuritic chest pain, low back pain, stiffness, stooped posture, painful sitting, forward flexion, rotation, and lateral flexion of the spine is restricted, fatigue, low-grade fever, weight loss, anemia, and an increase in your eosinophil sedimentation rate. The scar and the collagen of the pathophysiology will decrease the mobility. The back pain and the stiffness will increase with rest, but decrease if you move. So you got to keep moving with ankylosing spondylitis. The pleuritic pain is usually due to involvement of your intercostal spaces, your rib areas. And this is showing the progressive deformity of ankylosing spondylitis over a period of 36 years, from somebody that started in 47 and ended in 73. Gout is when you have uric acid production or excretion that is altered, resulting in hyperuricemia, which is an increased amount of uric acid in the blood, and an increase in uric acid in the synovial fluid. Now, uric acid is excreted in the kidney normally. The pathophys, you have cellular metabolism of your purines that are altered, causing an increase in uric acid metabolism. With gout, you'll either have a decrease in your glomerular filtration rate of your urates or an increased reabsorption of your urates with impaired renal flow. It can cause monosodium urate crystals to form in the circulation. So you will have hypothermia, trauma, acidosis, hypoalbuminemia, alcohol, all cause the crystals to precipitate. And the pain is usually in a peripheral site. It is abrupt. 50% of the time it's in the great toe. It lasts about 1 to 2 days. Tends to affect males between the ages of 40 and 50. As I said, you'll have hyperuricemia, which are tophi, or little stone-type pieces, renal stones. You're going to have recurrent attacks of monoarticular arthritis. That means only one joint's affected, and it's usually the great toe. You'll have deposits of tophi in and around the joints. You can have renal disease and renal stones. There are 3 stages. The first, the patient's asymptomatic, but if you did a blood test, you'd find a lot of uric acid circulating. The second stage, they'll have acute gouty arthritis. It's very painful. And the third stage is you'll have monosodium urate monohydrate crystals, or tophi. So tophaceous gout after 3 to 40 years. I like old movies, the old black and white ones that were around when my mom was a young woman. And there was a movie called Captain Blood with Errol Flynn. I hope some of you have some idea what I'm talking about. The book was written by Raphael Sabante. And it's a good read, too, if you ever have time to read something that is not schoolwork. Anyway, in Captain Blood, the governor had gout, and they treated him by bleeding him, by removing blood to get rid of the inflammation and the evil humors. It's a good film in that it's an action film. It's also a romance. But if you get it, be sure and pay attention to him treating the governor for his gout, because you'll see how it was treated back in the 1600s. This is showing gout, and on the left is in the great toe, and on the right it's in the hand, the left hand. This is showing tophi. You can see the crystals, uric crystals, in that hand and on that heel. Disorders of skeletal muscle. A contracture can be physiologic, which is temporary, or it can be pathologic, which is a permanent muscle shortening due to spasm or weakness. You can have disuse atrophy, where you lose 3% of your muscle tone daily when you're on bed rest. You can have myotonia, which is a delayed relaxation after voluntary muscle contraction. It's like you make a fist and it takes you a while to release your hand. This is inherited, and it's due to an increase in muscle excitability. Pathologic contracture, by the way, could be secondary to a stroke, scar tissue formation, a burn, something like that. And here's a picture of a contracture. And the best way to prevent this would have been to do range of motion. This ends part 2 of the musculoskeletal.